Hello, welcome to Let's Talk Health with Dr. Chris. We are still on diabetes self-care series. So if you've not watched the previous episode, please do well to watch them. Also subscribe and share to your friends so that they can follow this lecture. So today we are talking about complications of diabetes. It's a very important topic as far as diabetes is concerned because the aim of the management of diabetes is to ensure that the diabetes does not develop complications. And as I said, that most of the complications will arise due to sugar icing the blood vessels to the body in the body tissues, also called glycation. So, if there is icing of the white blood cells, which are the defenders or soldiers of the body, it will lead to a condition called lazy or blind soldiers. And you know when you're being defended by a blind soldier, that it will make the diabetics not to able to defend themselves from simple infection. So it will reduce the immunity of people with diabetes. And so the person becomes prone to every infection that passes by. So someone with uncontrolled diabetes will have poor immunity, just also almost like someone with HIV infection. Remember, the emphasis is on uncontrolled diabetes, but if it's well controlled, the level of glycation will be minimal and the immunity will not be that poor. The next thing is if the lens of the eyes are icing of the lens of the eyes, it can lead to people with diabetes having cataract. Diabetes can also affect the other parts of the eye, causing poor vision. It can affect the other parts of the eye, like the retina, causing poor vision. Icing of the vessels of the kidney will lead to leaking of kidney leaking leaking of protein in the urine. It can lead to kidney failure. Icing of the nerves. Nerves are like wires that carry electric activities or impulses in the body. It will lead to numbness of the limbs. The diabetes will feel as if he or she is walking on a foam or putting on stockings. So that will make the person not to lose the diabetic to lose sensation because the nerves has been high. The diabetic will not have lose sensations, and you can step on broken bottle without even noticing it. You can step on hot object without noticing whether the object is hot or cold. And this loss of sensation can lead to wound or ulcer on your foot without knowing. And the infection of this ulcer can become a very serious condition called foot gangrene. And this foot gangrene is what usually leads to amputation in diabetes, and it's very dangerous. So, one is that because of the lazy soldiers, the infections or the wound will be difficult to heal. The healing, there is slow difficulty in wound healing, and the infection can easily overwhelm a diabetic that has poor control. You then fungal infections like candida and oral thrush, which are more common in people with a low immunity. These are the things that you can get from poor management of diabetes that leads to complication. And if this icing or damage to blood vessels, it can lead to heart attack or stroke because and impotence in men. So those are the complications that can arise from icing of the blood vessels by uncontrolled diabetes. Thank you.